Well, hi, everyone, and thanks for joining. I'm Dr. Jeff Brook, the Scientific Director of CANU, the Canadian Urban Environmental Health Research Consortium, and I'm based at the Dalla Lana School of Public Health at the University of Toronto. Thanks for joining and welcome to today's webinar on CANPATH and CANU. Today, we'll hear from four presenters from CANPATH and CANU, who will share more about our expanding collaboration and the 17 newly linked environmental exposure data sets available for request and analysis. Before beginning, I would like to say that we acknowledge the traditional territories of the Mississauga of the New Credit First Nations, Anishinaabe, Wendat, Huron, and Haudenosaunee Indigenous peoples on which the CANPATH National Coordinating Center and CANU at the University of Toronto now stand. The territory was subject to the Dish with One Spoon Wampum Belt Covenant and an agreement with the Iroquois Confederacy and the Confederacy of the Ojibwa and allied nations to peaceably share and care for the resources around the Great Lakes. With CANPATH and CANU teams working across Canada, however, from coast to coast, we also acknowledge the ancestral territories that are home to many Indigenous peoples from across Turtle Island, and we are grateful to have the opportunity to work on this land. And speaking of the Great Lakes, today I'm coming from the town of Midland, Ontario, on Georgian Bay, and I'm located on the land which is the traditional territory of the Huron-Wendat and the historic homelands of the Métis. And this is a region that's home to a large and diverse community of Indigenous peoples, and I'm grateful for this place and its natural wonders. We're going to begin now, and I'd like to introduce our speakers briefly. The first speaker is going to be Danny Doiron, the CANU Managing Director, and he'll share more about the origins of the CANPATH and CANU data linkage activity. We'll then move on to Joey Sire, CANU Data Director, who will speak to the environmental health data updates. And then Trevor Dummer, CANPATH National Scientific Co-Director, will provide an update on his new book, Understanding Cancer Prevention Through Geospatial Science, Putting Cancer in Its Place. This book covers how geospatial science can support cancer prevention and features CANPATH and CANU in one of its chapters. Shiraz Chima, CANPATH Data Manager, will provide a walkthrough of the CANPATH portal and an overview of the access process. We'll save Q&A for the end, but there is a Q&A button. So throughout the presentations, please drop your questions in there and we'll try to get to them as soon as we can. So thank you, and I'm now going to turn it over to Danny for the first presentation.
Okay, thank you, Jeff. I will start with a bit of background on CANU for those of you who are not familiar with the initiative. So CANU, or the Canadian Urban Environmental Health Research Consortium, is an academically funded initiative that was supported by CIHR's Environment and Health Signature Initiative. So our original grant was between 2016 and 2021. We then subsequently received a 3-year extension from CIHR in 2022, which will end in March 2025. So CANU is a multidisciplinary consortium with experts in environmental health and epidemiology, in urban planning, data sciences, and public policy. And our members come from academia, but we also have members at different levels of government and in the private sector. And CANU's core mission is really to push the field of environmental health forward in Canada. So we do this by assembling a large amount of health-relevant environmental exposure data in a central data platform. So the data that we assemble and that we develop cover 5 core domains and include air pollutant concentrations, estimates of neighborhood greenness or vegetation cover, neighborhood factors such as walkability, community amenity proximity, and neighborhood socioeconomic and deprivation indices, and health relevant weather and climate metrics. So many of the data sets that we collect and that we developed or assemble are shown on the left of this slide here. We index all these data sets to Canadian postal codes, and this represents over 800,000 data points for giving exposure and year. And so indexing our data to postal codes allow us to link all these different environmental exposure and built environment data to health databases such as the Canadian Partnership for Tomorrow's Health. So since we launched our program, we've developed close collaborations with health data stewards from across the country to link and integrate our exposure data into their databases. So in addition to being linked to CanPath, Canoe has pre-linked data available via the CHILD study, the Canadian Longitudinal Study on Aging, the CanCOLD COPD cohort, and our data is also available via administrative health data stewards from across the country. So over the years, we've become the go-to source for geospatial environmental exposure metrics in Canada. Since we launched, we've supported over 350 individual projects with more than 400 researchers and trainees from all major Canadian universities using our data. We now have 42 data sets with more than 330 unique variables that we make available free of charge to the Canadian research community. So this slide provides a quick overview of the process that we use to generate geospatial exposure data sets and subsequently make them available as analysis-ready files to the research community. So we began by assembling standardized data covering the entire country from which exposures are estimated. So the source data that we use come from a variety of different sources, and these include high-resolution satellite imagery, large geospatial databases, monitoring data for air pollutants, and census data for socioeconomic status indicators. We then model exposure estimates using different methods and index this data to six-digit postal codes. The values of our exposure estimates are then extracted for each of these postal codes and are formatted as tabular format data sets. And finally, using the six-digit postal codes as the linkage key, the exposure values are linked to health databases such as CanPath, typically using the subject's residential postal code. So we've been linking Canoe data to CanPath and its regional cohorts since 2019. And this slide here shows you an overview of the different Canoe data sets that have been linked to CanPath over 3 successive rounds of data linkage. And at each round of linkage, we not only add new exposure data sets, so new data sets that we've assembled or developed at Canoe, but we also update previous data sets with new years as new years of data become available. Joey will go into some of these data sets in more detail in a minute, and you can also access full descriptions, full metadata for each of these data sets from our data portal at canoedata.ca. So as I mentioned earlier, since we started distributing data in 2017, we supported over 350 data requests, and these projects have led to more than 190 peer-reviewed publications and over 30 graduate student theses. Some of the papers resulting from the linkage of canoe data with CANPATH cohorts are highlighted on this slide. And these projects have looked at a number of different environmental exposures and various health outcomes, including, as we see on this slide, studies examining the impacts of walkability and a neighborhood environment on physical activity, on BMI, metabolic health, sleep disturbances, and COPD. Trevor will provide some examples of the types of scientific outputs that have resulted from Canoe CANPATH data linkage collaborations in a couple minutes. But for now, I'll pass it over to Joey, who will provide some more details on the types of canoe environmental exposure data that you can access via CANPATH.
Yeah, I am here. Hello, everyone. I'm just unable to turn on my video for the moment, but hopefully you can all hear me. So as Danny mentioned, I'm the data director for Canoe, and I'm just going to bring you up a little closer to the sort of nature of Canoe's data holding and hopefully give you a little bit of intuition of what you actually get and how it's derived and how you can use it. So as Danny covered, there's a number of these sort of domains that we have data for. Typically, we don't sort of call noise and transportation their own domains, but I do mention them separately here just to begin because they do sort of have their own orbit in terms of having teams dedicated to their study and developing those data sets. But typically, we just sort of refer to these domains as neighborhood factors, air quality, greenness, and then weather and climate. And so what I'm going to do is sort of walk through each one of these groups and as I say, just sort of unpack some of the details of these exposures and how they're derived. So when we talk about like what defines our data holdings, I think there's really three considerations. The first, of course, is geography. Time is a really big one, and then how that data was produced. So in terms of how the data is produced, it's pretty straightforward. There's surveys, things like the Canadian Census, or it could be based on observations like weather stations, and last, it could be modeled, as is the case for some of the air pollution data sets I'm going to look at today. But first, I want to just get to geography. So as Danny mentioned, we really work with these point locations and we're using postal codes. Now, postal codes are technically areas. We all know that from, maybe living in a suburban neighborhood at one point in time, or even at a apartment building. And what we do is we take the place within that postal code where most people live, and then we just apply a simple point to that location. And that's really what is used to link to these other environmental databases. And that's also very convenient because then we can link to human databases, since typically those databases are going to have a postal code included with the persons under study, under data collection. So on this map, we're just looking at a snapshot of postal codes here at the University of Toronto. But we have these for all of Canada. And so in this sort of context, there's these two attributes of the geography component. And so one is the extent. And as Danny mentioned, we're always talking about all of Canada. That's really Canoe's scope is all postal codes across Canada. And that does include over, there's my slides, over 800,000 postal codes. So tremendous extent. And then there's a resolution to this data too, which are these postal codes. They're highly accurate in terms of geography. Now, a caveat to some of this is that these postal codes are not always going to link to environmental data that are the same high resolution as postal codes. And it's typically coarser and might cover a wider area. So postal codes might have data that are similar to their neighbors. And in this example, what I just turned on in the map is NO2, where these pink colors are showing a higher concentration on average, and the purple is showing lower ones. In this case, this actually isn't all that bad resolution. but that's not always the case. So just keep this idea of sort of how varying some of these values are across space, because we'll come back to that when we unpack some key data sets next. And I want to talk about time, obviously. So we're also thinking about this extent, this sort of footprint attribute, which is when a data set covers, but also the resolution, which are typically in time steps such as month to month or day to day. And last, just in the context of how exposures can really be tailored and characterized to individuals, where we're not always just interested in that postal code itself, but perhaps the experience or the nature of the environment around a postal code. So on the screen, you're seeing two circles around just one of these postal codes. And I've shown a map of tree canopy here where darker green are higher tree areas and whiter areas are lower treed areas. And so you can see, depending on how you sort of define those circles, you might characterize the experience of trees at your place of residence a little different. And this is also a good way of demonstrating just how many data sets we have, because we can kind of multiply the number of time steps over the number of these spatial definitions and come up with a coarse estimate of. So hopefully there's a little intuition there, thinking about the extent, thinking about the resolution, and just how some of this data is really derived. So now I'm going to walk through a number of the data sets that are pre-linked CAMPath. Some of these were linked in previous efforts and some are new. Air pollution, nitrogen dioxide is one that was linked some time ago. But I'm going to just walk through this and promote its use. It's definitely one of our most downloaded data sets. I checked the Canoe portal and it's been downloaded over 200 times, which is a large number of times. Now, this is a data set that was originally built for 2006, but has actually been scaled according to air pollution surveillance measurements all the way back to 1984 and then up to 2016. So a real strength of this is also that it's at 30 meters spatial resolution. So if you recall that first pink and purple map I showed you, that's why there looked to be some kind of granularity there at such a high resolution. So one thing I want to also just mention here is what it means when I refer to modeled data. So I'm just going to quickly show some basics behind what that means. This is far from exhaustive, but it's hopefully going to, as I say, instill that intuition. So for an NO2 data set, values are estimated by a class of models called land use regression models. And this is where we just take everything that's kind of on the right side of the equal sign here, things like factors from the neighborhood. So in this picture, you see buildings, you might see trees, and we combine that with satellite measurements of NO2, as well as things like emissions from any given sort of industrial site. And then what we do is basically come up with an equation that explains NO2 at a very good monitoring site. And then we take that equation, we know what the math is, and we just apply it back to places of residence or postal codes. And so that's kind of how we get to this idea of measuring something at a home location, for instance, without actually having on the ground monitors there. And we know pretty good just how accurate that is, and it's quite sufficient for our work for sure. So hopefully that just leaves you with a bit of an understanding of how model data arises. And the next data set I'm going to talk about is again a model data set. And this is something called the Canadian Optimized Statistical Smoke Model, or CAN-OSSM. And this was developed by a fellow at the BC CDC named Naman Paul. And it's used to estimate fine particulate matter, which is commonly called PM2.5. And this is optimized for wildfire or biomass smoke. And this is obviously a pretty important and relevant topic these days. So again, we're using a lot of measurements to estimate at locations where we don't have actual observations. And this data set covers 2010 to 2022 at daily, monthly, and annual scales. And then it comes at a 5 by 5 kilometer grid. So if we think back to that, original image of postal codes I show you, that's one case where all of those postal codes would kind of have the same value. But since this is sort of like a regional exposure, meaning the variation within that 5 kilometers is probably not much, um, and the fact that this data covers all of Canada at daily resolution, it really makes this an unparalleled item in terms of these space and time attributes I've been discussing. In other words, it's a really good data set and definitely deserving of usage and study, given what we're seeing with our wildfire events here in Canada. Okay, so I'm going to change to a new domain now. I'm going to talk about a neighborhood domain and one of the really good data sets there. And it's called the Canadian Active Living Environments, or CANAL. So this is a census-based data set, which obviously makes it nationwide coverage, and it's available for two censuses, 2006 and 2016, and available at the dissemination area geography. And so that means there's about 400 to 700 people living there. So it's a pretty high resolution geography. And this data set has a lot of important variables that, as Trevor May mentioned, they have associations with things like obesity. So there's one variable here for the number of four-way intersections within a given distance. And so that might be sort of a proxy or an indication of just how walkable a neighborhood is. And there's some others here as well. There's like the number of transit stops or points of interest, and it's also combined into a singular index as well. So that's perhaps one that's worth looking into. And Canoe has a ton of neighborhood data sets very similar to this one that are worth exploring. And just to move along here, I don't want to take up too much time, but I do want to talk about greenness and some of our greenness data holdings. Oops, sorry, I haven't changed my slide. There we go. So I'm going to try to talk about two different sources of greenness. One is from a satellite program called MODIS, and this is our longest continuous measure of greenness from 2000 to 2023. There is another satellite program called Landsat, but it has like different cameras, different sensors that have shown up over time, and they might just have some little variation between them. MODIS has been one single sensor the whole time. And of course, being satellite data, this covers all of Canada. And although it goes through a lot of data processing, I definitely call this observational data. It's measuring greenness down at the 250-meter spatial resolution. Now, one kind of, the way greenness is measured is something called NDVI. And this is a normalized score from -1 to 1, where values closer to 1 indicate greener areas. Without going too much into it, it can be a little unintuitive because there's some problems with that scale. And so I'm going to talk about one next, a new data set next that might get around that a little bit. But one thing to keep in mind here, and I really hope that this helps emphasize this idea of how exposures change over time and space. And so this is a good example to just think about where, well, greenness varies by season. So what can Canoe do to facilitate how you might want to characterize greenness in terms of an exposure for your research? And so one thing we do is we have multiple variables for any given data set. And so in this case, we'll take a, say, 500-meter circle around a postal code, and we'll take the average of greenness. Or maybe we'll take the maximum of greenness within that area. Moreover, maybe we'll even narrow the time margin to, say, just the growing season, which is something like May 1st to August 31st, and only measure an average or a maximum within that time span. All of that data is already linked. It's already available with CANPath. It's already done on Canoe. And that, hopefully helps you characterize your exposures as needed. It gives you the data you need to really examine your questions. And so I'm going to just move to the next data set really quickly. This is a super new data set. It's called vegetative greenness fractions, and this is based on something called Landsat. It's at 30 meters resolution. You'll see in a second the difference between that and MODIS. And this is a data set that comes at a scale of 0 to 100, as opposed to -1 and 1. And I think that makes it much more intuitive to examine just how green something is, because we're maybe more used to scales like 0 to 100 than -1 to 1, and what data means along those spectrums. So one thing that is really interesting about this data set is you can imagine a satellite from space looking down, and it's measuring what it sees on the surface of the Earth. This vegetative greenness fractions has the ability to penetrate through things like tree canopy cover and detect the presence of roads and buildings underneath a canopy. So, while it might appear green from the sensor, this vegetative greenness fraction layer can actually show things like roads or building underneath and revise the greenness measure accordingly. Another way to think about this is that if you just saw a field of grass, it's going to appear very, very green because there's nothing else in the signal that's going to alter that. So this could be a really good, and it's a very recent data set, as I say, it could be a really good opportunity to study sort of those vertical layers as opposed to just the horizontal layer of greenness, perhaps getting some signals from what's underneath canopies and better contextualizing greenness. And I think I'm taking just a tad too much time, but the last thing I'll show is just, again, Queen's Park here in an aerial image on the left. And on the right is the vegetative greenness fractions. So we can see the nicely treed area, kind of dead center in the middle in the park. And then you can almost tease out where the roads are because they are in a pretty pale green. And it's too much. I don't have enough time to sort of get into that vertical layer thing that I'm talking about, but it is in this data and it's very interesting. And then the last thing to come sort of full circle is just to show you what MODIS looks like, the 250-meter resolution data set on the left. And hopefully this gives you an appreciation, if you will, of how the spatial resolution matters in terms of sort of the questions you're seeking to answer. So hopefully that wasn't too much, but I definitely wanted to, leave you with some of that intuition around these key parameters of space and time. And good luck with these data sets. Thank you.
Oh, hi everyone. Thanks for that. I'm not here just to shamelessly promote a book. Jeff kindly mentioned the the book I've edited, but what I really want to talk to you today about is some of the work that and the potential that can be got out of the linkage between the CanPath data and the Canoe environmental variables. I'm a health geographer, so my interests in cancer prevention are really understanding how the built and natural environment and all those different things that are part of that are environmental exposures, the way some of our actual behaviors, such as physical activity, our access to food, healthy food, some of the exposures we actually are subject to, how that's impacted upon by geography. And obviously, CanPath as a longitudinal cohort linked to cancer registry data has a lot of potential for epidemiological analysis to identify risk factors and help us understand more about some of the complex causes of different cancers, but it also can really support prevention, and particularly in the sphere of in understanding how some geospatial science and geospatial data sets impact our cancer risk. So the old adage, prevention is better than cure, certainly is consistent with what we know about cancer, because although cancer is to a certain extent can just be some random errors in cellular reproduction, there's a lot of other things that go on related to genetics, biology, but also a load of external factors that actually impact our cancer risk. And cancer is actually a very preventable disease. Um, so we know that up to about 50%, 40 to 50% of all cancers could be prevented by just applying some of the evidence that we already know in an appropriate way. And many of the cancers are actually well over that. So cervical cancer is virtually 100% preventable. It's caused primarily by HPV virus. So vaccination against that virus will prevent cancer, but also we can screen for early detection. So cervical cancer, early detection and prevention is a real success story. But a number of other very common cancers are also highly preventable, related to a number of different risk factors that we understand. So we can prevent cancer. What's really important to understand as well is many of the exposures, many of the things that we actually do, because often when we talk about disease prevention, we're talking about behavior change or changes to your exposure environment. But some of those things are potentially outside our own control. So we might not be able to change certain behaviors because of maybe the impact of the built environment and where we live. So really understanding how geography and environment impacts all these different things like exposures, like behaviors, is really important and helps us to better understand how we can prevent, better understand how we can actually target interventions in populations where the need is most, or in populations where the certain risk factors and behaviors and other environmental factors may be most relevant to that prevention. So this map is it's quite old, but this is basically looking at some work I did in the UK, looking at children's eating habits. And this was a cohort study as well, and it was linked to geospatial data. And overall, the impact of socioeconomic status and poverty on eating behavior was, as is often the case in many health outcomes, it was strongly associated with socioeconomic status. But when you actually drill down and look at the spatial distribution of the children's eating behaviors and looked at that in relation to socioeconomic status, in this case, we were measuring it by community deprivation, there were some places where that relationship didn't actually hold out. And if you looked even further at some of the built environment factors in those sorts of places where actually there were areas of very good eating habits, in areas which are actually quite socioeconomically deprived, which went against the overall analysis that we saw when we looked at everything grouped together, not by geography. And that was because of certain factors in the built environment. And we could drill down into those and look at things like walkability, as Joey's already mentioned, and access to various various different things that could impact diet and physical activity. So really, when you drill down the analysis at the small area level, you can actually see that there's some things that are going on where our overall relationships might not actually hold true. And that's really the context of the book that Jeff mentioned. It's trying to understand small area variation, apply geospatial science to risk factors and to cancer data to better understand in small communities what is actually going on, so we can actually better target prevention. And really exciting putting this book together. And really important chapter in that is actually looking at how cohort studies, as they're really important for cancer prevention, how cohort studies enhanced by geospatial data, such as the CanPath-Canoe linkage, can be really used to better understand geospatial and environmental risk factors and better understand how we can maybe target some of our prevention activities. And that's really what I want to focus on now as a case study of how we've used some of the CanPath-Canoe data linkage to really better understand cancer risk. And this case study was bladder cancer risk in the built environment. This was put together by a graduate student of mine who's been working for a number of years in this area. So Joey mentioned three important Canoe data sets: NO2, air pollution, CANAL, Canadian Active Living Environment, or CANAL, or a measure of walkability of neighborhoods, and also green space. So what we did in this particular analysis is we linked, obviously those data were linked to the CanPath data, and within the BC Generations, which is the BC regional cohort that's part of CanPath, there's linkage to cancer registry information. So we have incident cancer cases. So what we have is a load of variables from CANPATH connected at baseline. We have cancer incidence from baseline onwards. So these are people newly diagnosed with a cancer after they've been recruited to the study. And we've also linked those to indicators of green space, walkability, and air pollution. So in this analysis, we're looking at incident bladder cancer risk in relation to those variables. So moving very quickly on to the results, as we have one more speaker and then we want to have plenty of time for questions. We used a Cox proportional regression analysis to look at the impact of greenness, walkability, and NO2 air pollution on incident bladder cancer risk. We divided the exposures into tertiles, low, medium, and high for each of them, where low was the reference. So here, where you see a hazard ratio above 1, you see an increased risk. Where you see a hazard ratio below 1, you see a decreased risk. If your confidence intervals cross 1, then you've got a non-significant association. Did a couple of models. In our first model, we're just adjusting for a range of individual level confounders that we know might impact on the relationship. We didn't see any significant impact of greenness. And one of the challenges related to greenness and NDVI is a measure of green space, but it's actually a measure of access to parks and wooded and treed areas and green areas, which we know can impact health. So that's a discussion for another day. Walkability, there was a significant increase in the medium walkability compared to the low, but that was attenuated in the high, and that was non-significant as well. I'll talk about that in a moment. What we did see is a significant increased risk of bladder cancer in relation to NO2 as a doubling of risk. As you can see, a hazard ratio of 2.09 for those people in the highest tertile of NO2. Also, because many of these built environment variables are actually collinear, we actually did some additional analysis where we adjusted for all of these confounders, plus also the environmental data sets as well. And what we see is, again, no significant association with green space at all. With walkability, that slightly interesting thing where it looked like there was a dose response, even though it's non-significant. So actually, as you increase walkability, which is you think should increase health and wellness, it impacts physical activity. Certainly, you were seeing an increased risk. Actually, that risk became non-significant. Sorry, it was still non-significant, but actually in the highest tertile of walkability, it was actually a protective effect. So we're not really sure whether, what we can't report a particularly significant finding, but there's potentially something going on. And when one of the things we understand, we know about bladder cancer, about 50% of the cases are caused by smoking, but there's other risk factors we understand about as well, physical activity being one of them. So perhaps this is indicative of something related to physical activity. But certainly the risk in relation to NO2 held in this second analysis where we're adjusting for the other environmental variables as well. So just as a quick summary, green space, we saw no association between incident bladder cancer risk. Walkability, certainly no consistent association, potential for a protective effect in high walkability areas. But this was non-significant, but I think this is an area we really should look in more detail at, particularly because we know that walkability does significantly impact physical activity. We did see a significant increase in the highest tertile of NO2, air pollution exposure, and this was in both models. And International Agency for Research on Cancer has identified NO2 as significant cancer risk, predominantly because of its association with lung cancer, but also some suggestion in other studies in relation to bladder cancer. So this is certainly something we would like to look at in a bit more detail. Realize I'm running out of time, and I think Danny did this very nicely anyway. This is just some examples. The Canoe geospatial data have been used extensively in a number of CANPATH studies, and Danny identified some of the significant publications as well. This just gives you a flavor of some of the analyses and some of the data sets that have been consistently used. So I'll just hand you over to Shiraz now. Thank you.
Hi everyone, I'm just getting my video going, but just take a moment. Hi, there I am. Thank you everyone for that excellent overview, and we're very excited for this new linkage that we've done with Canoe and the CanPath. I'm just going to give a quick overview of our data portal, which allows researchers to get a little bit of a resource, and it's a great resource to help researchers explore and evaluate all the potential of the CanPath and Canoe merged data sets, and then request access subsequently. So just quickly, I'm going to mention that, as my colleagues said, that the key strengths of CanPath's collaboration with Canoe is the robust and wide-ranging set of environmental exposures that are captured. And this allows the potential for all types of analysis and in different domains, not just geared towards disease prevention, but even detecting and applying to developing healthier environments. So quite a range, and really honing into the potential for all this data. And when it comes to speaking of the strengths, one of the great strengths of the CanPath platform, along with Canoe, is that it tracks participants as they go through their trajectories. And longitudinally, this is great and is very valuable when it comes to researchers that are looking into the detecting accurately and assessing the impact of any prolonged exposure and any other behaviors or any other factors when it comes to health outcomes. And CanPath aims to continue following up with patients and participants, collecting information for the next 20, 30 years. That's really our goal. And we find that the longer we continue to collect data, the more valuable that actually becomes to researchers. So this is just a quick screenshot of the actual portal resource, and I'm sure many of you may have had a chance to go through it, but I'll try to do a quick walkthrough if I have some time. If not, that's fine, I can answer some questions. But it's a great resource because it really walks you through how you want to go about formulating any research questions and the full process of gaining access to the CanPath resource and the Canoe resource. Similar to the Canoe data portal, we have an Explore Data tab, which allows anyone who's interested to browse the unique 18 harmonized data sets, evaluate any variables, and I'll take a few minutes to hopefully walk you through that. But here's just a quick look. So the portal allows researchers, as I mentioned, to look at everything that we have and give an overview. So we have more than 4,000 harmonized variables in our data sets in the core data set, which spans across 6 cohorts and is really a pan-Canadian cohort of its own, which captures sociodemographics, healthcare utilization, physical measures, a whole wide range of information, even our recent COVID-19 testing and results. Additionally, we have diverse subset information. So we have genotyping for more than 50,000 participants through our national and regional partners, as well as EMR-based research data, imaging data, and cognitive assessments with partnerships with various other groups. And the more the data continues to come in, the more we continue to add it in. For example, just a few months ago, we added our follow-up data sets for the serology or the antibody COVID-19 study. So the second and third follow-up time points, which are available on our to explore in our data portal now. And they just capture information more related to the COVID-19 symptoms, vaccinations, hospitalizations, and any COVID-19 test results as well. So quite valuable if you're a researcher looking into that. And we hope to continue growing this platform. This is just a quick, big snapshot, but as you can see on our data portal, the Canoe environmental data sets have increased. The list keeps going, and we hope that it keeps getting bigger and better. There's a link there that also allows you to go into the Canoe data portal and explore more of the metadata and the context behind each of these data sets that are now available through CanPath and Canoe. So really a great resource, and I'm hoping I can show you that very soon. This, as Danny mentioned, CanPath has added 17 new environmental measures to the previously 27. And the strength is that not only is it more data sets, but we have also included the second and third phases of the antibody study follow-ups, which I just mentioned, including the Canoe variables that are tied toward them. And this is important to understand that we merged them based on the time points of the data collection. So the year at which they were and the phase at which they were collected, baseline and follow-ups. So CanPath will link the Canoe data for each participant included in each wave. Since everyone has, most of the participants have completed a baseline, they will have at least a baseline Canoe data set. And for any subsequent follow-ups that they complete, we will first confirm and update their postal code, and then update and create a new version of the Canoe environmental exposures associated with all the information from that data collection phase as well. And the way we do it really is interesting too, because it'll factor into how you do your analysis. Is we try to pick the year closest to the data collection point for each participant. For instance, if a participant completed the baseline in 2011, we have exposure data available for 2016 and 2006 and 2016 for some environmental exposure. So we would link it to the 2006. This method was just chosen in order to ensure consistency and coherence across all the environmental exposure data sets. So as such, you might find participants that have different, baseline and follow-up information available for their environmental exposures, possibly because they've moved or changed their postal code. So just to mention that as an important factor, when you're considering applying to get access. So just a number of things that I wanted to quickly mention, and I know we're getting over time, but I'll try to quickly go over it, is that these are some of the key points when you're considering getting access to the CanPath and Canoe data sets. We go through a rigorous process of reviewing and seeing if all access requests align with CanPath's vision. So basically, I would just suggest, looking into the participant and the cohort of interest to you, the selection criteria, and trying to specify as much as possible what information and data holdings you are interested in and what your research objectives are. In the case of environmental variables, we recommend carefully going through the Canoe data portal and our data portal and really seeing what time points and years are available for your analysis. And then, of course, there's the sample size. Hopefully, I'll be able to quickly show you that. It's available, rough numbers are available on our data portal. And of course, you can always get in touch with our team in order to dive more deeper into the specifics of a potential research direction. I just wanted to quickly mention, and I'm sure many of you have seen this on our portal as well, we go through a rigorous access process, but with the Canoe data holdings, because they're merged, they go through an expedited review, and that's quite a benefit because you don't have to wait too long in order to get your hands on quite a lot of valuable environmental data, along with the biological and the lifestyle and behavior data and health data that is available through CanPath's harmonized data sets. So just to mention that, if you're not looking for too much administrative linkage or any biosamples or different sorts of things, you can still have an expedited review and have hands on the data quite soon. Now, I'm going to attempt to, in the next 2 minutes, just quickly share my screen and do a quick walkthrough of how it would look like. Okay. So I think you can see now the data portal on your screen. And like I said, it does a great walkthrough where you can go through the cohorts, the data, and the different ways before going into the access and requesting it. With our cohorts, you can see we have quite a lot. We have a pan-Canadian representation through 6 regions. And you can really dive in deeper and go into, the time points of their recruitment, the years that we have data collection for, and try to also extrapolate all of the environmental information that's there too. I know I showed this previously, but here it is again. This is the environmental data set, and quite a big list, but luckily you have the link to go into the Canoe data set and to also see what's available here. One of the things that's cool is the data portal itself, so you can quickly go in and look in the variable level. So if you're interested in something like cancer, you can just type it in here, and it'll display all of our variables that are in all time points, and you can kind of sift through and see in which time points that's available. So for instance, if we just pull up breast cancer that was tracked in the third antibody study phase, you can see a small summary statistics that's provided here. And if you want to dive in deeper, you can always reach out to someone like myself in our access office to get a deeper look into each of the variables and the information available. So you can do something like that. You can select the variables that you like and drop them into your cart, and that automatically gets into your portal submissions as well as you prepare your submissions to gain access as well. So just a quick walkthrough to show how easy it is to get into the CanPath data set, learn about what we have, and just hopefully do some exciting and innovative research as well. So I'll stop sharing now. And I think, that's everything for me. Thank you, everyone.
Okay. Right now I can't get my video going again. This is Jeff Brook back. And I really want to thank all of our speakers for presentations, and there's been some great questions that have been coming in the Q&A. So much appreciated for receiving those questions. Many have been answered on the fly. So if you've been monitoring the Q&A, you can see answers and questions there. There's one question that was from Melanie Jeffrey that was directed to me, but I'm going to direct that to Danny. I think he can cover this one, but it's about the resolution of the PM2.5 data, air pollution data, and its potential use in more northern communities, specifically First Nations communities. And Danny, maybe you want to highlight some of the types of PM2.5 data we have for Melanie.
Sure, yeah. So we have PM2.5 data coming from the University of Washington, which is at a 1 kilometer spatial resolution. This data goes back, I think, from the late 1990s onwards. And then we also have the CanAwesome data set that Joey gave a brief introduction to. So that's I believe also 1 kilometer, that's a 5 kilometer data set. And it's essentially a fine particulate matter exposure concentration estimate that is optimized for wildfire smoke. And that data set's available from 2010 onwards.
Great. Thanks, Danny. I don't see any other open questions at this point in time. I do note that there was some questions that were going on around about the use of greenness variables in Trevor's analysis and which ones to use. And that certainly is a good question in terms of how do you choose amongst the many environmental variables that are brought into the data sets. I'm not sure, Joey, whether you want to elaborate a bit more on how we distinguish between different growing seasons or different greenness variables, or even access to greenness, because I think we've had some new additions to access to greenness that are being considered in future data sets.
Yeah. Well, the one thing I didn't touch on in my talk was telling you which one to choose. And the problem is that there's a lot to choose from. There are different sources, there are different spatial resolutions, they cover different time periods. So yeah, we acknowledge that can be a challenge. But I would say that, it sort of begins, as always, with knowing kind of what's going on in your literature space and what other folks are using. The MODIS and Landsat ones are quite reliable. They're quite well used. And both of those, we try to be really clear on the Canoe website about the things that I've touched on. So what year does a given data set apply to? If there's a given variable, is it trying to be representative of that entire year? Is it trying to just, and based on only growing season, what was the growing season? How is that defined? Because sometimes folks define it differently. So I would definitely encourage you to first, understand what those variables are defined as by looking through the Canoe data entry for any given data set. But yeah, in terms of like which one to choose, it's probably going to be driven by the existing literature. That's always the place to see first.
Thank you, Joey. Yes, that's something that is difficult to do, is to say which is the best variable. And I noted another question came in earlier regarding as we talk now about new data being brought into CanPath and some of its updates of earlier data. Do users who have acquired that data in the past need to go about requesting the new data? And by and large, yes, you wouldn't be pushed the new data automatically. So this is a really good prompt to say pay attention to this space and what's there. Reach out to us for any questions you might have. Sometimes what's linked is a little further behind what we're working on. Canoe really does benefit so much from the community at large and wanting to share data that we can then make available to everybody. So it's not always our data. So pay attention to the metadata and who's developed it and where those teams are going as well, just to stay current. I know we're really near the end of time. Hope this was really informative for everybody today. I really thank everybody who attended and your great questions and taking an interest in Canoe and CanPath. We'll continue to try to keep you updated. But I'm now going to turn it over to Megan Fleming, who has a few announcements, and we'll close out this webinar. Thanks again.
Awesome. Thank you so much, Jeff. Hi, everyone. I'm Megan. I am the Communications and Knowledge Translation Officer here at CanPath. Just wanted to jump in for a final announcement about the next event that we're hosting. So we're hosting a hybrid event with 4 of our summer practicum students. We had our first summer with practicum students this past summer using CanPath data. They were all using environmental health data, specifically on air pollution, and each of them was looking into a different chronic disease. So these 4 Master of Public Health and Epidemiology students from the Dalla Lana School of Public Health will be hosting or presenting at a hybrid event on December 10th at noon Eastern time. Hope you can make it. You can use the QR code on the screen, or you can find the link in the chat. We'll also be sending you the recording of this webinar and the slides and information about this next upcoming event soon after this event, once everything is up on YouTube and whatnot. So thanks again for attending. Feel free to send any questions that we didn't get to info@canpath.ca or access@canpath.ca. And we hope to hear from you soon. Thanks for coming.